You spotted her. There she is. Hello. Loverly.
I'm a blonde. Since then, that was the last tumor I had. I haven't had a tumor, and that's since I had the Coleys. I haven't had a tumor, and it's been 12 years.
12 years. And how many tumors had you had before that?
Oh, I don't know.
Well, name the sites. Name where they hit.
My ankle was the primary, and then I had 3 or 4 in my calf, lower below my knee, and then it spread up to my groin area in my thigh, and then it spread to my lung, and then they cut all of those out, and then it spread to my abdomen, and then the abdomen is when I got the Coleys treatment, and that's been my last tumor.
Wow.
Doing great.
You sure are. You sure are. What would you change about U.S. medicine? I mean, you've been through this. You had to do something quite extraordinary to get your treatment.
When I made the decision to go with Gerson, which led me to Coleys, it was very hard because everybody was, not everybody, my family was with me, but everyone else was against me because it was illegal. You can not only change your whole lifestyle, but you don't have any support in any direction from anyone, which makes it even harder. Plus you're battling cancer, which makes it even harder with that. So there's no support, and it would have been very, very nice to have support with doctors, with insurance, with our society.
How many surgeries did you have, Sharon?
Oh, I don't know. I lost count. A lot. The treatment that they wanted to give me was hypothermia. They wanted to separate my leg with the treatment. Give me a lethal dose. They told me a lethal dose of chemotherapy, but it would be okay because they would separate the veins in the blood.
That's limb perfusion hyperthermia with melphalan. That's what they wanted to do.
Yeah. And then I said, well, if you did that, what are your chances of it being gone? And he told me that he couldn't give me any better prognosis, that he couldn't tell me anything more that it would make me better, and that I had somewhere like a 20 or 30% chance that I would lose my limb, I'd lose my leg. And I thought to myself, what kind of treatment is that? So I made the decision to do only things that would be healthy for me. So Gerson was absolutely healthy for me, made me unbelievably healthy. And then the Coleys was really, really hard, painful, but I knew it was my immune system fighting me and doing me good. So I wouldn't have done anything different. I wish it would have been easier for me to do that and not be going against the grain, and you know, insurance doesn't pay for it, which is ridiculous. I mean, they'll pay for all these extremely expensive therapies that don't work, and then here's this one that is not nearly as expensive, and it worked. So I don't understand that at all. I don't know where these brilliant minds are, and they can't see those things, but that's how I feel about it.
That's lovely.
A lot of people don't believe me. Let's just say that. There are people who have, some people like my friends, when we have friends that have cancer, there's a lot of people who end up with cancer, they don't believe me. They don't, you know, it's because if they go to their doctor's not going to tell them this. And if they were to believe me, they would be up against the same thing I was. They'd be going against their doctor. They'd be going against society. And that's very scary for them when they're faced with something. And that, I don't know if that changed my life, but it irritates me because, you know, I would really like to tell my story to more people. It's frustrating when they don't believe me.
But her story is true. She really did have a thoracotomy with wedge resection for a left upper lobe lung melanoma metastasis. She really did have a laparotomy with a sigmoid colon resection for a later metastatic melanoma recurrence in the abdomen. Her last surgery was the resection of a small bowel stricture and takedown of her colostomy. Melanoma struck her at age 28, and by the time she was 36, she'd had 9 surgeries.
I know what saved my life. The Gerson and then the Coleys. Gerson got a good handle on it, and Coleys put a stop to it. So it did save my life, and I'm very grateful for that. And if someone in my own family got cancer, I would know where they would be going. You know, I wouldn't give them the benefit of the doubt to even go to a doctor. No, forget it.
It should be in the U.S., shouldn't it?
It should absolutely
Should
be in the
US.
U.S. It should be covered by insurance. It should be covered by insurance, and it should be a viable option for people who don't want to do chemotherapy, and especially like melanoma. Chemotherapy doesn't work. The doctors know it. I mean, it's in the literature. It doesn't work. So what do they have? The interleukin and all of that, which doesn't work either. There's nothing that works for melanoma patients who are except, you know, the early detection. If it's in the late stages, nothing works. So the Coleys worked for me. I was there.
Beauty that words cannot recall. All her power shall rest on the strength of her freedom. Glory shall rest on us all. Come on and take a walk with me through this green and growing land. Walk through the meadows and the mountains and the sand. Walk through the valleys and the rivers and the plains. Walk through the sun and walk through the rain. Here is a land full of power and glory. Beauty that words cannot recall. All her power shall rest on the strength of her freedom. Glory shall rest on us all, on us all.